Dr. Wishnie, what is it about ingrown toenails? You mentioned it a little bit with the fungus and all that, but what are the reasons why people get them in the first place? And of course, tell us about the cure or the treatment connected to it.
Okay, ingrown nails are caused by improper shoes, the improper size of the shoe, improper cutting of the toenail, which is basically you should cut your toenails straight across and then file them round instead of cutting them in the corners, because you cannot see the corners, so you'll leave something in there like a little spicule that will get infected. Or trauma like something fell on the toes and now the nail's been damaged and now it grows ingrown with the ingrown nail. So those are the main causes of ingrown toenails. Treatment is actually a very, very simple procedure, and it's like 5 minutes it takes in the office. I think it's 1,000 times better than a root canal. And we just numb up the toe, and then we just cut out the ingrown nail with a regular nail nipper. Nothing fancy. And we put a little tiny chemical in the corner of the ingrown nail part so the ingrown nail doesn't come back. That chemical kills the root of that ingrown. You still have a normal looking nail, but that ingrown is gone. Now I'll tell you, if you don't put that chemical in, within 6 months, the day that the procedure is done, it will come back. And if you're like, if you're a child, 10, 12 years old, I want you feeling better, and I don't want you to be afraid of me, and I don't want you to numb me up again. So I want to get rid of that ingrown and have you go on your way. So like I said, it's a 5-minute procedure. Afterwards, you just soak your feet for about maybe 5-10 minutes. We have this ointment called Emerigel, and a lot of times you don't even need to soak your feet with the ointment, and you put that on twice a day for a week and cover the Band-Aid, and that's it. And you're able to go on your own merry way. You might not be able to wear your high heels for about a week or so, but you're able to go about your regular business throughout the day. And so this is interesting. So basically, it's cured and fixed forever. And I guess because of, that particular ointment or whatever it is you put on, which kills the root, that's why home surgery, I guess, doesn't work, right? We keep cutting away and keep messing with it, but it doesn't do any good because it will keep growing that way, right? Right, that's typical bathroom surgery, we call it. Yeah. And you try to fix it, and what you do is you keep on cutting further down, and it's painful and it gets worse, and then it gets really infected. And once it gets really infected, it takes longer to heal. Then you have to be put on an antibiotic. And so something that's simple that could heal in a couple of days now might take a couple of weeks. Now, once the surgery has been performed, or the clipping, as you did say it's really rather just bang bang anyway, especially for ladies, for instance, does the toe or wherever it occurred, I guess it can occur anywhere on the foot, not just on the toe, I assume. Does it look good? Can that person wear sandals and still look aesthetic, normal? I mean, the ingrown toenail could occur on any toenail, right? Not just the big toe. Number one, yes. It looks like a normal nail. You have a normal nail there. Okay, doesn't look operated on and stuff. Okay, well that's good. That's correct. So no other handicaps in terms of sports. You deal with lots of sports people, so it's not that all of a sudden it's like like if you would have your big toe missing, you probably would have problems running or doing certain things, but it's not that severe. It's not that severe. You can get back to most of your sports in a couple of days within the week, usually, depending on the sport, depending on the shoe you're wearing. So, yeah, absolutely. All right. Good. There's hope. Thank you very much, Dr. Wishnie.